Welcome to your Black Plague training. In this, you will become a full-fledged plague doctor. Best of luck. You got this. Some ways that you can stop this infection from getting worse is a new technique we're doing called social distancing. I advise you, plague doctors, future plague doctors, to talk to the village head, the head of the village, and order this new social distancing practicing. Keep people away from each other, families only in houses, not near close family, get them away. Close family only. I hope that this new technique will prove useful, and maybe in the future, people will listen to it and use it more. Oh, hello. So for this lesson, we're going to be talking about body cleanup. As you may know, the plague is not very nice to most people. One of the ways we can stop the infection from spreading is body cleanup. To do this, we have to take the bodies and dispose them in a large area where no civilization would be. For example, this field. This would be perfect to place them and burn them. I advise, whenever you see a body, analyze it, count it. Make sure you keep in your head where it is and how many you're going to dispose of to know the fatality rate. Thank you. So in this lesson, we're going to be talking about the religious marches that are going on and those people whipping themselves in the back. It is believed that this plague is in fact a punishment of God for the sinners. And with these religious marches going on, it is actually spreading the infection of the plague. And with a heavy heart, we have to try to stop this. I know, it gives people hope, but in reality, it's just making things worse. So we need to stop those people from whipping themselves in the back. We need to stop the marches from happening throughout the streets. So find out where this activity is going on and do your best to put a stop to it. Alright, so in today's lesson, we're going to be teaching how to tie a tourniquet and then cut the artery for bloodletting. This is believed to take out the infection through blood. So what you want to do here, I got my patient right here, is you want to apply the tourniquet like so. You want to cross, and then you want to put the stick that you have. This is a stick. Put it right here, and then tie it. Tie it around. Obviously, use a rope, not a Chromebook charger, but those don't exist. And you put it there.
Ropes don't exist?
No, they don't exist yet. They don't exist yet. Put it there. Boom! Look at that, beautiful. And then to apply pressure, you go there, and then can't feel circulation anymore. Good thing. Get the artery, cut. As you can see there, and then it will go into either a bin, cup, whatever you want. Make sure it does get disposed of. You do not want that around. It's infected blood, and this is one way you can aid a patient in need. Hi there, welcome back to the second lesson into aiding patients who are infected with the plague. So for this one is a method, leeches. These things, leeches. You can get them at swamps, buy them in the markets, all that. So for this, you're gonna need to grab one, don't let it bite you, and then put it on the patient's vein, and it sucks out blood. You can put more than one. Just go, suck out the blood. These can be very effective. believed to be very effective in getting out the infected blood, and they do it. When you pull them off, it leaves a mark. So you gotta make sure that the blood doesn't get to other people, so it doesn't infect them, you know. And then, yeah, leech is another way that we use to fight back the plague. Everybody, in this lesson will be about how to prepare yourself for the outside and to stop yourself from getting the plague. That's very important. Help others, you need to be okay. So you got the supplies that are needed. Right here are the leeches to help out with the sucking off the blood, the tourniquet for the bloodletting, accompanied by the scalpel, and the cane. For the cane, this is actually an accessory they use to actually push people away from them. So they just pushed them away. Like they didn't let them go near them at all. That's literally what this was used for. And then your mask. The reason why it's like this is because they stuff spices in it, such as dried roses and lavender and peppermint. That's what they put in the mint. Yes, mint. And they put that in the mask and the stuff of the nose is we believe that it stops you from catching the plague. And your gloves, of course, are obviously important. You don't want to be touching dead bodies, infected patients with your bare hands. And then you got the hat here, just look cool, and looks cool. And you get the gown to stop you from, you're like very protected, really no part of your skin is showing at all. So yeah, choose wisely what you want to buy at first. The most important essentials that you need at first, because maybe you're rich and can afford all this, but yeah, essentials, buy them first. Spend your money wisely. Guys, welcome back to your lesson on becoming a plague doctor. For one of your responsibilities is to keep track of the infectious areas in England. So this is a map that you will be looking at. These are the different regions you need to make sure have so here's an example. So when you go to a different region, your job is to make sure to track the infections in the area. So as you can see right here, this is a really hot zone, region 4. And this is where you guys started off. And this is where it started, from the pier on 1. So you just need to keep track of the patients, and you'll be given reports on how infectious it is and how to write the little circles to show infection. And this is what you will be receiving, a blank one. And this will be up on the board to tell you where to move to. So yeah, mark the infectious areas. Congratulations on completing your training to become a plague doctor. You are now a plague doctor officially, legally. Thanks to your bravest efforts at the pier, hopefully, and your excessive training through this process. You are now first assigned to go to Region 4. The village, the head of village knows that you're coming and will hire you and pay you. Your job here is to assist patients and contain as best as possible in here. So make good decisions and good luck on your adventures.
There you go.